Dr. Matthew Grunkemeyer with Commonwealth Orthopaedic Centers. I'd love to talk to you today about a question I get commonly asked in the office, which is this: Doctor, I've got arthritis of the hip, knee, foot, ankle, etc., but I want to stay healthy. How can I continue to exercise but not hurt so much? What I do is recommend that patients do ask these questions, and sometimes you don't even think about them, because if you don't, what you're going to end up doing is getting hurt worse and then be back in the office to see me again. So just like you wouldn't want to go swimming directly and jump in the deep end of the pool if you've never been before, you don't want to start a really high impact exercise program and then end up injured again. Speaking of the pool, that's where I like to start patients after they had either a lower extremity injury or if they're suffering arthritis. The nice thing about the water is it eliminates gravity, allows you to move the joints but without as much pounding and impact. I would recommend that you start out in an aquatic-based program, whether that's swimming, whether it's water aerobics, or just walking in a pool. After you're able to do that comfortably for about a half an hour, then you can progress onto the land. The best place to start there is on a bicycle. It can be a stationary bicycle, recumbent, or even outside with your kids. This is a good way to exercise the joints but to have lower impact. Moving up the ladder next, you can start on an elliptical trainer. Elliptical trainers are nice pieces of exercise equipment because your feet are placed solidly onto the exercise machine and they're moving at a constant rate and speed. After you've successfully mastered this, you can begin walking on a treadmill that has a cushioned surface and you can do at a constant speed. If you're successful with that, you can begin walking on the road surface and walking with your significant other perhaps for exercise. Notice that's in the middle of this exercise program, not in the beginning. Most people want to start out walking many miles at home and they don't realize this could cause more harm than good unless you've progressed up the ladder. Then if you're successful walking, you could start a jogging program. Once again, I'd start on a treadmill. After that's successful, then jogging outdoors is acceptable. If you're able to do all those things at a comfortable level without too much pain, then you can get into your more aggressive sports, twisting and cutting type of sports. And for this, I'm talking basketball and I'm talking tennis. I'm talking Zumba and CrossFit and other what I would term very high intensity exercises that are causing a lot of different motions across the joints. You may not be able to progress all the way up to these high-level sports, and although that's disappointing for some, clearly you can see you have a lot of good, healthy exercise options that will enable you to continue to live the type of healthy lifestyle that you want, even if you have an arthritic joint. Thank you.